Oh.
And I'm telling you what, you're going to want to watch this because there's a lot of info. Who you are and what makes you happy.
I'm happy to be with you today. I'll tell you that. I'm proud to be a member of the team with Medicare Advantage Majority. We are a non-partisan nonprofit organization dedicated to protecting and strengthening the Medicare Advantage program for more than 35 million seniors and people with disabilities around the country. In Arizona alone, more than 780,000 of your seniors are enrolled in the Medicare Advantage program. That's 52% of your eligible Medicare population. So our coalition is powered by hundreds of thousands of advocates nationwide, including many Arizonans, and from beneficiaries to caregivers, healthcare providers, community leaders, really the entire caregiving ecosystem who care about this program, have a vested interest in this program being protected and strengthened in the years ahead. And for your viewers who don't understand the benefits of Medicare Advantage and the appeal of Medicare Advantage, that goes beyond traditional fee-for-service Medicare. And so Medicare Advantage, most plans include benefits including dental coverage, hearing coverage, vision, in-home care, prescription drug coverage, that Medicare Part D that we talk a lot about. And importantly, Medicare Advantage includes a cap on annual out-of-pocket costs. And so if a senior has a medical event during the course of the year, they know what their cap will be for an out-of-pocket self-pay. So all of these benefits really model kind of the best of the entire Medicare program, all packaged into one. And of course, plans vary from provider to provider and plan to plan, sometimes market to market. But that is the hallmark of the Medicare Advantage program, and why it's the top choice for seniors who are of Medicare age and who get to choose.
Well, with all that being said, I mean, a lot of people need to pay attention to some of this stuff that is going on because it affects everybody, and it's not, and nobody's like exclusive from this. So, what kind of preparations should some of the seniors and anybody that is willing or wanting to know about more about Medicaid? What kind of preparations should they be doing?
We say that the hallmark of the entire the Medicare program is choice. Choice is a big component of the entire Medicare program. So when a senior turns 65, they have the option to enroll in a traditional Medicare plan, a fee-for-service Medicare plan, which is exactly what it sounds like. Every time you need a service, you pay a fee, or Medicare Advantage. You get that choice. And again, I've gone through the benefits of Medicare Advantage and why we believe it is the premier option for seniors. The good thing is, though, if a particular plan is not working out for you or for your senior, at the end of every year during open enrollment, you have the ability to re-enroll in your current plan or make a switch to a different plan, either going from a Medicare plan to a Medicare Advantage plan or vice versa. And so, seniors have that option every year, and we encourage them to talk to their doctors, talk to family members, often, caregivers, a son or a daughter, or even a grandchild is a caregiver, part of the seniors caregiving team. And so talk to them about what makes sense. We know that caregivers really enjoy and appreciate the benefits of the Medicare Advantage program because it includes things like helping with one point of contact to make doctor's appointments with both your primary provider and a specialty provider. Often helps with paperwork, having paperwork all in one location. Seniors have the opportunity to take advantage of the prescription drug delivery, which is a huge component for seniors living in more rural and remote communities around the country. And so there are a lot of benefits of the Medicare Advantage program that come included.
Well, it's kind of crazy when you start thinking about insurance. Not many people, I mean, especially maybe my age or even younger, they all try to figure out what is going to be working and what is supposed to be happening and how it's supposed to be happening. How did you get involved with this actual task?
Yeah, it's a great question. This is personal for me. I feel like we're probably the same age. I'm probably a little older than you, but I am a member of the sandwich generation. So, my wife and I, we have young kids at home that we're taking care of, but we also have aging parents and aging family members who need more help than they did even a few years ago. And so the fact that Medicare Advantage provides kind of that backstop, that security for the seniors in our lives, that makes this a very important program to us as caregivers, as we take on more responsibility for their medical care and getting them to doctor's appointments and make sure they got the right prescription drug coverage and things like that. Helping them get transportation to and from events and doctor's appointments. So All of these things, we find that Medicare Advantage is really helpful in that endeavor.
As you start speaking, in the generation that we are in, we definitely have to take care of our parents now.
Mhm.
Now, when we start thinking about that, how is it going to affect the majority of seniors currently right now?
That's a good question too. We are focused as an organization. We are focused on making sure that seniors are educated and empowered to understand what happens in Washington D.C. In terms of policy making regarding the Medicare Advantage program. That trickles down really quick to Prescott, Arizona, or Midland, Texas, or Louisville, Kentucky, or wherever seniors are around the country. It gets what happens in Washington finds its way to the local level pretty quickly, and so our efforts with our hundreds of thousands of advocates around the country is to make sure that members of Congress know how important this program is to the 35 million seniors and people with disabilities who are on this Medicare Advantage program, as well as the caregivers that I just mentioned. If you think about it, if you deck even one or two caregivers against all of the 35 million enrollees right now, that's a 100 million people. And so that is a very big number of people who are affected by any decisions in Washington regarding the Medicare Advantage program. We want to make sure that Congress understands this is a program that needs to be strengthened, protected. Funding does not need to be cut, because if funding is cut, seniors are going to face billions of dollars in costs as a result, and they're going to lose access to the doctors and services they need. They may have a higher premium, higher deductible, higher out-of-pocket costs. And those are things that are really, really treacherous, especially during these high inflationary, high cost times we're in right now.
Wow. And just for anybody that's watching, feel free to go ahead and ask a question. We'll see if we can go ahead and get some questions answered, because I know a lot of people do have questions, and sometimes people are just lost when it comes down to this, especially when the jargon that you put into the sign here and everything will be fine.
Yeah.
And sometimes you gotta pay attention to this stuff. And I'll tell a little bit of a story. My father, he had certain insurances that were covering certain things that weren't covering other things, and it was just like trying to find a balance on how it would work for my father. And then obviously, as you get older, different illnesses start showing up, different like priorities start showing up, and the cost in general, especially if you're on a retirement, there is like little window of error for this, because
Yeah.
it could really put a senior out on their streets. I mean, I feel like we're having a little bit of a scenario right now where we were talking about foster care. All right. And I know this is we're talking about younger kids, but we now are starting to talk about how seniors are being displaced because of cost and because of significant others passing, and they were just like, I don't know what to do, and then they find themselves in a very, very bad predicament. So here's a question for you. Now, when you're guiding into helping the senior community, what is like, if you could give me maybe two or three or maybe even 5 points that if somebody's watching right now, what would you do as a son to a mother or a father, because this is their era right now? What would you say to them? And just give like 5 points, like what to do today.
Yeah, this is and you bring up an important point. I think that, the elephant in the room right now is the cost of healthcare, the cost of gas, the cost of groceries. This is and maybe we want to talk the politics of this in a minute, because this could be a huge issue in the midterms. But affordability is on the ballot for sure. And so, we view this as a year-round issue. Our focus moving forward as an organization is to make sure that seniors' voices are heard and that Medicare Advantage continues to deliver the reliable, high quality, affordable care that so many seniors depend on. I would say that the majority of seniors on the Medicare Advantage program have incomes of less than $25,000 a year. Unlike younger workers whose income will adjust every year with a cost of living adjustment, seniors don't see that, and so they, and especially with this inflation, this high inflation, seniors want to make sure that they've got reliable, steady funding for a program that they value, like Medicare Advantage. And so, to your earlier point, the majority of people on Medicare Advantage who have multiple chronic conditions. So if you've got diabetes or COPD or heart disease or high blood pressure, those individuals are more likely to choose Medicare Advantage because of the comprehensive coverage that Medicare Advantage provides, that one point of contact to help get you from your primary physician to your network specialist and the like. And so, this is an appealing program for many reasons, but again, for seniors who who are veterans, who are lower income, this program is a safety net for those populations as well. And so, I would tell people that, again, talk to your doctors, talk to your family members, talk to your friends who may have gone through this process and who may be a few years older than you. But you and I are. I like to make the joke that yesterday I was 35, today I'm 50, and so this choice for me, is going to be here, in the blink of an eye before I know it. And so, we are fighting for the seniors who are enrolled in this program right now, but also for those who are in the pipeline coming into Medicare age in a few years, and for those like us who are 10, 15 years out. We want to make sure that this program is well funded, it is protected, and that Congress stands up for what they promised to protect seniors.
Well, with that being said, how can us as a community member actually help with this process? What do we need to do in order for us to go ahead and make sure that our mothers and fathers, grandma and grandpas are all being taken care of?
Again, our organization, we're focused on helping to educate and empower seniors, and to make sure that they know that they have options when they feel like their program is being threatened. And so we help to empower them by getting them in touch with their members of Congress. As you know, all politics is local. And so, why everything in Washington has an impact, it goes the other way too. And so we've got a grassroots coalition that is very active and very vocal. Seniors can go to our website, which is MedicareAdvantageMajority.org, to learn more about the program, to learn more about our organization, but also to send a customized note to your member of Congress. Click a button and you can send a letter voicing your support for this program. And we find that very helpful. That has come in, our seniors have come into play around the country in this past year alone, during budget reconciliation conversations in Washington, when this program was targeted for potential funding cuts. It happened recently, earlier this year, when CMS, the Center for Medicaid and Medicare Services, proposed a very flat income investment for 2027 Medicare Advantage payment rates of 0.09%. Our seniors got active, and CMS relented and bumped that up to 2.48%, which is better. But again, it's something we're focused on and will continue to focus on going forward.
With so much going on in the government in general, we obviously have to have that conversation, because sometimes when it happens up top, it trickles down to us downstairs.
Yeah.
One of the things that I was hearing through the grapevine, maybe you could go ahead and help. Is there anything in your kind of realm talking about how the affordability of medicine is going to be affecting any of this, or is that something that's not even in what you're trying to talk about?
Well, it's the price of medicine is, of course, impacts everybody. The fact that Medicare Advantage programs, most Medicare Advantage plans, include prescription drug coverage, and so that is something that is, again, bundled with again, your hearing coverage, your vision coverage, dental coverage. All of those things are packaged into most Medicare plans, Medicare Advantage plans, unlike traditional Medicare plans. And so it's less of an issue for those on Medicare Advantage. But again, the high cost of drugs is a problem that we all face as Americans right now.
Okay. So and we're going to get to the end of this, because I know that you have a very, very busy day. If somebody's watching right now and is like wondering what to do first, what is the first line of task for anybody that wants to get on this?
Yeah, again, I would say go to our website to learn more about the issue, learn more about our organization, how to get involved if you would like at a local level. We have a lot of, again, supporters and ambassadors in Arizona, which we are grateful for. There are large pockets of senior populations in Arizona and in Prescott, where you are. There are a lot in Florida, a lot in California, and so these are pockets where seniors really come together and have an impact. And I'll tell you why. Because in 2024, more than 40 million seniors came out to vote in that election a couple of years ago, in the presidential election. That was the highest turnout of any age group in the nation. And so what we say is that the President Trump understands this. His pollsters called seniors the deciders for their ability to move an election when they rally behind an issue. And so, as we look to the midterm elections, which is going to be a very important election this year, affordability is on the ballot. The cost of living is on the ballot. 91% of the seniors that we talk to believe that Medicare Advantage is not only a health issue, it's an affordability issue. They want to make sure that the funding for Medicare Advantage is stable, and that they can rely on a program that they have paid their entire careers into. Seniors have paid into this Medicare program for their entire lives, and they expect that the government is going to be there to provide them with reliable, affordable, comprehensive health coverage.
Well, it feels like sometimes you just need a lawyer to understand a lot of the stuff that goes on. It's just like, we just need help. Give us help and let us be people that we can just live our lives. So I appreciate what you are doing, my friend. If there's any last closing statements or remarks that you would like to go ahead and make, we'll go ahead and get you back to your day to day. And I know that everybody that's out there is going to be watching this. So whatever you got to say, my friend, this is your stage.
Well, I appreciate you having me on. It's great to talk to you. It's great to talk to great people of Arizona. This is an issue that, again, matters not just for those seniors who are on this program, but for their children and their grandchildren who are their caregivers, and for their community, for their neighbors. It takes a village to raise a kid and to care for a senior. And so, we are glad to be a part of this coalition, making sure that our policymakers in Washington, D.C. Stand up, protect, and strengthen this program for the seniors that they represent.
Well, with that being said, I'm going to let you get to your day. I'm going to get to my day. Happy Monday, everybody. And if you have any more questions, feel free to go ahead and message or even comment in the comments, and then we'll go ahead and get you the email address or even the address to go ahead and check it out, or the website. With that being said, guys, I am out of here. Peace, love, and happiness. Let it not be war. And remember, love always wins. We'll catch you guys later. Bye-bye.